The most important here now is get all your friends to join. Okay, so let's go. Let's just start by saying, okay, good. Our very own, very, very talented, intelligent doctor, Dr. Lawal, is in the building. Hi, Dr. Lawal. How are you doing? You're highly, highly welcome. Okay. Um, so today you're going to be our speaker today. Okay. Dr. Lawal, please can you say hi so that I hear your voice? Hello, Dr. Lawal. Dr. Lawal, can you hear me? Yes, I can hear you. Are you hearing me? I'm hearing you. Are you hearing me now? You can hear me now, right? Good, good job. So, guys, today we are discussing with Dr. Lawal. Dr. Lawal is a very highly intelligent doctor. She's here today to enlighten us. Those on Facebook, you guys will have to listen very attentively to her because, I mean, this is a Zoom meeting. She has been ready since last week. It's just like, we are trying to figure things out so that you'll be able to get this highly impactful discussion today. You all are highly, highly welcome to my live. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Yes, that's me. Today with us, we are featuring Dr. Lawal. Okay, she is going to give us the nitty gritties of mental health, everything you need to know about mental health. We encourage you to ask questions and please be very, very attentive. I beg all of you because this training is very, very, very educative. Okay, all right. So, Dr. Lawal, take it away. Thank you. Dr. Lawal. Dr. Lawal. Yes, please. I'm hearing you. Go ahead, please.
So Sonia has invited me today to come about mental health. I mean, just talk about what it entails generally. It's going to be a short one, so I'll be glad if you pay attention. The aim is to educate the populace, what to be well carried along, so that people can improve their attitude towards seeking better mental health for themselves and people around them. When we talk about health generally, it is a state of complete well-being. A lot of times, people tend to feel that their health, once their physical health is fine, people feel, oh, I have no headaches, I can walk around, I'm not feeling so I'm fine. But we know that the states of the mental health is equally as important as that of the physical health. So mental health well-being is very important and should be prioritized. Now, when we talk about mental health, what do we do? It is a state of well-being that enables people to cope with the regular stresses of life. We all know that it's impossible to go through life without stresses.
That's true.
Sometimes it is family, sometimes it is a job, Sometimes it is your friends, you know. There are different things out there to stress us, and stresses are a regular part of life. As a matter of fact, coping with stresses has to be a regular part of life. So because we have to learn to cope with stresses. So in mental health, so people should realize their abilities. They should know what they are able to do, and they should be able to balance this well, so they can balance their work well and contribute properly to the community that they find themselves in. So when someone is healthy in their mental state, they're able to do all of those things that I've mentioned, cope with the stresses of life, balance their work, contribute to the community that they are in, and still be able to function and not break down. So
Please pause there. Did you all hear her? She said you should be able to balance your mental health and be able to, right? Okay. I hope you all are paying attention. This is very, very important for all of us to take every note of what she is speaking, because she is an authority when it comes to psychiatry and everything about mental health. Okay, continue.
all right, so having said that, sometimes as with physical health, things don't go as planned. Sometimes people break down. The way someone can have a physical illness, they can have a mental illness. And we are really advocating that the stigma around mental illnesses be abolished, because if someone can have headache and walk into the hospital
That's
and
right.
nobody looks at them a certain way, then they can have challenges with their mental health too. And people wonder, so what are some of the reasons why people might have challenges with their mental health? Sometimes people's genes can make them more likely to have these challenges than other people. For some people, they may have people in their families that have had some breakdown in the past. And mental illnesses are common. 1 in 5 people in their lifetime will have some form of challenge with their mental health. So it's not as uncommon as people may make it seem. Um, so when people have had somebody in their family that has come down with it before, it will make them more likely to break down. Apart from that, some people have very difficult circumstances, maybe early in life. Some people may have been brought up in areas where they are being deprived. Maybe they do not have their parents available, they do not have the support that they need available. And it may make them more likely later in life to have some challenge with their mental health. Apart from those that I've mentioned too, some people's present life circumstances, difficult circumstances, can make them break down. Some people can face losses, significant losses of people that are important to them, relationships that are important to them, jobs, or their means of livelihood. Things like this can also make people more likely to break down.
All right.
Sometimes um, some people may experience some challenge with their mental health when they use some street drugs also, and they may begin to have unusual experiences. Some people can have a problem with their mood.
Good.
That's how they feel. Just they feel very low in their mood, lose interest in activities that they would usually enjoy. And this may need some intervention, like coming down to the hospital, getting some support. I'll get to that. So, apart from that, these problems with their mood is a bit different from the sadness that some people may feel occasionally. Your life is not all a straight road, and on some days, people might not feel as happy as they may feel on other days. And that does not necessarily mean that the person has a mental challenge. And that is why, mental, illnesses are usually diagnosed after appropriate assessments by specialists, so that people do not just label other people of having illnesses. As a matter of fact, it's not legal to just go around labeling people if you are not if you are not a health professional that has sat down and has assessed them. And
Okay.
even after that is done, that would still be a confidential interaction with the person affected.
All right.
So you
That's
cannot just go
very,
around it.
thank you so very much. I hope you guys are taking notes of what Dr. Lawal, as a professional, is telling you guys. She said there are so many things that can predispose you to have mental health, such as genes, genetics. If somebody in your home have already had a sort of mental health, the possibility that you may likely have a mental health when you are exposed to, what we call predisposing factors, right? People that also do illicit drugs, such as marijuana, cocaine, and the likes of them. Meaning, there are so many out there that young people, both people in high school, even some children in primary school are all exposed. Another thing that can make you to have mental health is, from what she said, is if you don't have the family, you know, life where you don't have family that is supportive of you. You are in, let's say, um in a home where they put children together, right? Am I correct, Dr. Lawa?
Okay, so let me come in there
Okay.
to clarify what I've said.
Okay.
What I've said is that sometimes people have difficult
Circumstances. Okay. Yeah.
childhood. Some people grow up in plenty homes and get all
Yeah.
the love and support that they
Yeah.
need.
Yep.
However, some people really do have it tough.
Good.
Some people live on the streets,
That's
have
correct.
nobody at all to look after them.
Yeah.
So all of this, people that
Contributes.
are
Yeah.
abused in their childhood too,
Yep.
all of this could predispose to having a mental illness.
That's correct.
So um,
And then the next thing you talked about is loss of loved ones, right? That, or loved, or loss
yes,
of something
sometimes
special.
losses, not necessarily of loved ones,
Okay.
losses of loved ones, of relationships,
Yeah.
of
Of
jobs.
pets. Some people can have that too.
People have different things that they consider important to
To
them,
them. Okay.
and loss of any of those things
Mhm.
would also contribute. A lot of times, for most of the mental illnesses, we find that not one factor makes a person break down.
That's
A lot of
true.
times, it
Multiple.
could be
Yeah, I agree
multiple
with you. Mhm.
factors that eventually leads to this breakdown.
I agree with you. Thank you so very much. This is so very, very enlightening. Dr. Lawa, I couldn't have wanted any other doctor to come break this to this level, because you are actually giving us what we want to know and how we are going to understand what are the things that we should do or not do to prevent ourselves from having mental breakdown. Thank you so much. So you go ahead. I'm sorry, not to always come in and then, make the audience understand in case they are not understanding it the way. Though you are really making it very, very good, and even somebody that didn't go to school is going to understand everything you're saying.
That's very fine. So, sometimes the illness can come in the form of people losing touch with reality. So,
Okay.
for certain mental illnesses, people have a problem perceiving the regular things they do. per se.
Okay.
Sometimes they may begin to hear or see things that are not there,
Mm-hmm.
or misinterpret things that are there, or begin to make claims that appear to be unusual when we consider the person's regular pattern of behavior.
Okay.
This can also sometimes show in some problems with their behavior pattern, and people may begin to act oddly in ways that they usually don't. And people see that their ability to also take care of themselves might begin to decline.
Decline. Yeah.
So all of this, like I said, can be signs that a person might be having like an imminent breakdown or is breaking down.
Okay.
Some people also begin to feel really anxious, and they begin to consider very little things as big things. You know, they may also have symptoms such as being, tense, having chest pains, feeling their heart is beating faster than usual. Some of these are symptoms that people will have if they are dealing with an anxiety
Okay.
issue. Well, I said this to say that there's a wide array of challenges that people can have with their mental health, and it really does depend on the actual issue that they are having at the time. The good news with all of this is that there is help available.
That's correct. Did you guys hear her? There's help available. This is not the time for you to say, oh, it is my brother, it is my sister, it is my enemy, it is my friend that I love. This is the time for you to seek that help that you desire. This is the time people like Dr. Lawal and your psychiatrists come in. Okay? Stop thinking everything is a kind of or a sort of arrow thrown at you. Okay, so you guys, when you start feeling all that Dr. Lawa had all listed here, it is that time for you to go see your psychiatrist. All right, so go ahead.
And with this attempt to seek help, usually you would walk up to a mental health specialist, which are available all over you.
Yeah,
So once you are able to get in to see a mental health team, you would find that there will be support available for you with your mental health, and then socially too. Sometimes what people need is a strengthening of their social network to prevent this kind of illness from happening again. So the team will be available to provide all round support for you. Some people may eventually not even require medication.
that's true.
A good number of people may require medication, but even with that, there will be appropriate monitoring available for such individuals once they walk up. So I think I'm going to end this by just saying that if anyone is having any of these unusual experiences, there's help available. Walk into a hospital, ask to be directed to see a mental health specialist that will be able to assess you and offer appropriate help available to you.
Thank
So
you.
thank you for having me.
Thank you so very much. I appreciate all you said. And honestly, people on Instagram are really commenting and telling you are telling. In fact, some of them are saying most of the things that you said, they felt it, they saw it, and it happened to them. And now, one question I will ask you is assuming they are in a place where there's no mental health specialist, right? What are the things that somebody that is feeling this way can do? What are the immediate things that somebody can do to at least relieve him or herself of the stress before now, maybe taking a taxi or bus or whatever it is to the place where they can access, the right treatment. What do you think, a person can do when they face all that you are saying, like the anxiety, the loss of touch, and palpitation and all that?
All right. So to be honest, there's a wide variety of mental conditions, and some of them constitute actual emergencies that need to be seen in an hospital.
That's right.
So before we can be sure of how we can help this person, we need at least an initial
Assess.
assessment
Okay.
so that we can know what challenge
The person is
this
having.
person is having. And
Okay.
then from that point, so depending on what the diagnosis is, for some of the conditions, there are self-help techniques that can be taught.
Good. Let's just hear one or two. They have. That's what I wanted to know, because I mean, it's possible that somebody could actually have all these things and there's nothing the person. So let's have the self-help techniques, if that could, if you can have time for that. If not, we could actually do another episode and discuss that.
Okay, so for things like anxiety disorders,
Yeah.
depending on the severity,
Okay.
sometimes we'll be able to teach some people some deep breathing techniques
Okay.
and some just ways of relaxing
Okay.
so that they are able to deal with their anxiety better. But like I said, the best option is to still see a professional
Yeah,
because some people would require medication,
I agree
some
with you.
people would require other support,
Okay.
psychological support, as one sessions with psychologists for some of the challenges that they are.
All right. Thank you so very much, Dr. Lawal. From all we have seen, mental health challenges and diseases is just like any other thing. It is like malaria, it is like typhoid, it is like any medical issue that you have. Do not break down and think about what people are going to say, because guess what, there's a lot of stigmatization when somebody is is perceived to have mental health, right? But it's not supposed to be so, because guess what, just like your brain is an organ in the body, the eyes, the nose, the teeth, the breast, the reproductive organ, intestines, every part of your body have different kinds of doctors that take care of them. So, as far as you can go to your optometrist and they examine your eye and do cataract surgery and all that, or you can go see your doctor and they diagnose you of cancer and oncology starts your treatment, you know, the same way is what happened to the brain. I don't know why we should look at brain issues and then we think about it as, oh no, that person is crazy. We all need to understand that it is not a big deal for somebody to have a mental challenge. Like she said, there are a lot of things that can make you to have mental challenges. Seek that help that you require and let there be solution on time. I remember back in the days, they would just say, oh, that person has entered the market. His madness has gone beyond repair. All these things are, you know, psychological and um will I call it natural things that people talk about that is not reality. If you can go to hospital to treat yourself of malaria, so also you can go treat yourself, especially when you have anxiety. We are just talking about the simple psychiatric problems, or even when you have schizophrenia or maniac syndrome, depending on the kind of psychiatric problem you have. In our next episode, if Dr. Lawal, she is a very busy doctor. I know what I did to drag her here. Okay, she is very, very good at what she does. We will digress and talk about all the different types of mental health. Thank you all very much. Now, my final question for you is, how can people that are affected be helped?
Okay, thank you for that question. So, like I said earlier, the number one thing is to know that there is help available,
Okay.
and you do not have to go through whatever challenges that you are in silence. So once you realize that there is help available and you're ready to seek care, you walk into a hospital. If they do not have mental health services there, you can ask to be sent closer to one to the mental health
So
service.
yeah.
You'll be assessed by a multidisciplinary team, not just doctors.
Mhm.
Mental health team is a large one.
Yes, I
Consists
agree
of
with you.
nurses, specialists,
Psychologists, right, are also involved.
psychologists, occupational
Health, yeah.
therapists, a whole lot of people are involved in mental health care. So you'll be seen by the entire team that
Mm.
would identify the challenges that you are having, have an assessment, and then list out ways by which you can help. And the whole team to be joined in doing that. So once that is started, you will be supported. If you need medications, you'll be given. If you need to run tests, you will be asked to run the test. And then you regularly come in to see them. For some people, um, sessions with the psychologists might be recommended so that they can have more talking therapy. So in such individuals, you can have regular talking therapies,
Yep.
and the team will continue to see you to assess your progress level.
Thank you so very much. I mean, like I said before, there's no other doctor that I could have brought in for the person to break this mental health the way you did. Dr. Lawal, thank you so much. We appreciate you. And we say thank you, thank you, thank you. So we are going to come to the end of our assessment because she has other very important things that she needs to go address. We had to pull her from her busy schedule today. All right. Thank you very much for coming to the show. We appreciate you very well. And we say
Thank you
thank
for
you.
having me.
Yeah. And guys, you have heard it from the horse's mouth, right? Do the right thing. Go seek the mental health treatment you deserve. Don't sit down and say it is an arrow or somebody has thrown on you. It is just yet another medical issue that can be treated. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. This is the end of today's episode. In the next episode, we are talking about different kinds of mental health so that you know where you fit in and know what you can do to help yourself. Remember, mental health is real. And like we said, mental health is like every other medical issue. Thank you very much for watching. Bye bye. See you soon.